So if you're perimenopause and you don't know what to do, here's what you should do. I'm Dr. Wendy, I'm a physical therapist. I've taken care of women for 20 years, and I have been specifically studying this because I'm educating my patients on what is happening. So let me help you. Step one, if you think you are perimenopause, pull up the Notes app in your phone, and I want you to write symptoms as your title. Then I want you to start making bullet points of why you feel like rubbish. For instance, brain fog, anxiety, restlessness, can't sleep. You feel overwhelmingly sad, you are more irritable, you have itchy ears, you have joint pain, dry skin, dry hair, vaginal dryness, decreased muscle tone. You get the gist. So write your symptoms down, step one. Step two, I want you to make an appointment with your primary care doctor or your OBGYN, whoever you have a good relationship with. Now here's the important part. You have to have a flexible mind because we are not sure if your doctor even knows about these things or believes these things. I know this is silly, but not everybody has menopause training. I know that you think your OBGYN is going to know, but they're really good at surgeries and catching babies and vaginal health. Menopause, they may not know. Now, if you see an endocrinologist, the endocrinologist could totally help you out here. But try to have a conversation because you deserve a conversation. So schedule with your provider. It could be your OBGYN, it could be your primary care doc. If both of these are like, no, we don't give hormones, we don't even have this conversation until you're 1 year without periods, because that is the technical definition of menopause. If they are not willing to hear you, then you need to find a specialist in menopause because apparently this is a specialty. So you can go to the North American Menopause Society, go to that website, they're now called the Menopause Society, type in your zip code and find a provider near you. Now, if there are no providers near you, you can find a telehealth doc. There are options like My Alloy, there is MIDI Health, some are cash-based, some are covered by insurance. I know it is frustrating that you have to try this hard to get help, but hear me out. Now, in the meantime, things that I tell all my patients as a physical therapist is, what's your D level? Have you got your D levels checked in your blood work lately? Because I need you to know that your vitamin D should be like 50 to 70. If it's in the 40s, that's not optimal. And even though your blood work might show like it's in the green on your phone, on your MyChart, just because you're not like with scurvy and you're like depths of depravity doesn't mean that's optimal. I need you to be optimal because now that you are entering perimenopause, menopause, I'm all about nourishment, habits, activities of daily living, and being the best you, and I need your blood work to be good. Now, doctors that are trying to help you understand how close you are to actual menopause and your cycle ending would tell you your FSH and AMH can be checked in your blood work to tell you how close you are to menopause. Now, doctors who treat menopause and will give hormone replacement therapy, such as estrogen pill, estrogen patch, progesterone, topical estrogen if you have vaginal symptoms, compounded testosterone cream, will tell you they will treat you based on your symptoms. So blood work for checking those levels isn't going to necessarily give you a better care, but checking your FSH and anti-Müllerian hormone kind of tells you how close you are to the finish line. Now remember, perimenopause and menopause is 5, 10, 15 years. That's not very helpful till the end, but like it's still something you can check. Also, while we're on this note, things that you should put in your mind as reminders is I am all about women getting mammograms beginning at the age of 35 and getting that DEXA scan as much as you can. Prevention is better than treatment. I am in the wellness game. I am all about my women being informed and knowing how to look at your metrics, look at your numbers, and understand what we have to do to keep you optimal and healthy. So to do a recap, I need you to write down your symptoms because you might forget. So write it down in your notes in your phone. Make an appointment with your primary care doc, your OBGYN, or your endocrinologist if you have it. You deserve a conversation. If they don't want to give you a conversation, you can try one of the other doctors that you have, or you can go to the North American Menopause Society, type in your zip code and find a menopause practitioner near you. If none of those are near you, do a telehealth visit because telehealth is real, because you deserve a conversation. And I want you to know all about your body. I want you to know your D levels. I want you to know that your DEXA scans are good because you are your best advocate.